Hello everyone, and thank you for being here today. The presentation was prepared by the WHO Collaborating Centers for Arboviruses and Viral Hemorrhagic Fevers, Yellow Fever Regional Reference Laboratory at Institut Pasteur de Dakar. I am Jane Basile, and I will be walking you through this overview of quality assurance and quality control in the context of surveillance. Let's begin by understanding what a quality management system, or QMS, is. It refers to a set of coordinated and interactive activities that guide and control an organization in matters of quality. According to ISO and CLSI, the goal is to improve customer satisfaction by ensuring continuous performance improvement. All relevant aspects of the laboratory operation, including the organizational structure, processes, and procedures, need to be addressed to assure quality. Before going further, let's clarify a few key terms. A norm or standard defines requirements for how something should function or be performed. Quality assurance includes planned and systematic activities to ensure that quality requirements will be met. Quality control involves specific actions and techniques to make sure that quality expectations are achieved during testing. Laboratory information system involves methods for timely result verification, validation, and reporting. Laboratory Quality Manual is a document which fully describes the quality management system of an organization. Now, why do we need to assure quality in the laboratory? Indeed, quality assurance is essential in laboratories because it supports accurate, reliable, and consistent test results. These results are critical for informed decision-making in public health. Quality isn't decoration, it's how we enable safer decisions. Accurate, reliable, and consistent results make the difference between justified action and costly missteps. Without QA/QC, we bleed time, budget, and credibility. For surveillance programs, confidence in data quality drives timely interventions. Good QA/QC is a public health accelerator. Why do we need to assure quality in the laboratory? All lab processes are influenced by many variables: equipment conditions, temperature, technician skills, and information systems. These factors must be standardized and documented. To help reduce variability, preventative maintenance, training, control monitoring, and record keeping should be implemented in the laboratory. Our task is to standardize what we can, temperature controls, maintenance, time steps, and document what changes so we can explain the results. 4 habits reduce noise: routine maintenance and calibration, competency managed staff, in-process checks, and disciplined record keeping. Documentation is a key part of quality systems. We must be able to answer who performed the task, what was done, how did the operation take place, for example, was the protocol followed exactly, were there deviations, etc. Where was it done, and when and why? Proper record keeping allows traceability, accountability, and transparency in lab operations. Quality assurance can be assessed through several methods. First, external quality assessment, or EQA, includes proficiency testing, retesting, and on-site evaluations. Also, laboratories can use internal positive controls and regular external audits to ensure consistent performance. Consider these methods as complementary mirrors that help identify errors early and maintain long-term reliability. Each signal must lead to an action, defining the correction, prevention, responsible party, and deadline. Otherwise, we're collecting data without improvement. The QMS model includes 12 essential elements that cover every aspect of lab operations, from sample reception to results reporting. Managing all 12 elements effectively ensures accuracy and consistency throughout the entire testing workflow. The 12 essentials are organization, personnel, equipment, purchasing and inventory, pre-analytical and post-analytical process control, QC, documents, information management, safety, assessment, and improvement. These constitute a checklist in the laboratory process from sample reception to results reporting. For each essential, implement at least one relevant indicator and a review frequency. This figure illustrates the full testing process or path of workflow as followed at the RRL at Institut Pasteur de Dakar. It begins with the customer needs, that is, the patient sample, and ends with the customer satisfaction, which is the final result. Each step must be managed carefully under the QMS framework with equipment monitoring, procurement and stock monitoring, HR, facilities, safety and biosecurity. Let's start with the facilities and safety. A well-designed laboratory is essential to reduce contamination risks and to ensure the safety of both staff and patients. Safety is not optional. Neglecting it can lead to serious consequences, including harm to people and damage to the lab's reputation. Clear protocols, designated staff, safety manuals, and regular training should be implemented. Using proper safety lab symbols helps prevent accidents and ensures that everyone in the lab can identify hazards quickly. These symbols should be visible in all lab areas and be included in training materials. Equipment must be selected carefully, calibrated regularly, and properly maintained. All staff must be trained in how to use and clean the equipment. Staff should be designated to be responsible for specific pieces of equipment. Preventive maintenance and backup systems are essential for reliability and continuity, and an equipment management program must be in place. It's important to plan ahead to prevent equipment failure by making an accurate inventory and calibrating, verifying, maintaining, and monitoring the equipment. Here we will talk about purchasing and inventory. The ineffective use of reagents and consumables can cause financial loss and stockouts, leading to customer dissatisfaction. To avoid reagent stockouts or expired materials, both of which compromise test quality, careful inventory control procedures must be in place. A responsible staff member is designated for each element of the inventory management procedure, which includes systems for ordering, receiving, storing, and tracking supplies. Traceability and readiness are crucial, and stock should be verified before use, the expiration dates tracked, and reorder thresholds should be set to enable minimum stock levels to be maintained. Staff are the core of any laboratory. A staff manager must be designated. Staff must be qualified, trained, and clearly informed of their roles and schedule, and their responsibilities must be documented. Performance must be evaluated regularly to support continual improvement. The staff organizational chart and job descriptions must be clearly established, and regular evaluations of the staff and supportive feedback are crucial. Maintenance of good communication channels within the group are essential to ensure smooth operations. Proper management of samples is critical to the accuracy and reliability of testing. Proper sample handling starts at reception, and the sample labeling, collection date, transport conditions, and acceptance criteria must be confirmed before testing. Use of LIMS, starting from this point to result reporting, is important for sample management in the laboratory. Dedicated areas and trained staff are important to ensure that samples are tracked, stored, and handled correctly, and records of communications with sample submitter should be maintained. During testing, validated methods and standard operating procedures, or SOPs, must be available and followed. Staff competency must be confirmed and assessed regularly, and environmental conditions must be monitored. Quality controls must be included in every batch to ensure test reliability. After testing, results must be analyzed and validated by authorized personnel according to established result review procedure. That includes the use of a validation chart for test controls and the use of result interpretation criteria. Reports must be delivered securely to designated recipients, and access to data must be controlled to prevent tampering. Data must be stored correctly, and backups should be in place to prevent data loss, and proper storage and disposition of primary samples should also be ensured. Quality control uses control materials to monitor whether the test components are working correctly. QC must match the test method used, whether quantitative, qualitative, or semi-quantitative. It helps to distinguish between normal variation and true error. A robust QC program includes routine monitoring, result interpretation, and corrective actions when necessary. QC charts such as Levi Jennings help visualize trends and detect issues early. If QC fails, results must not be reported. Regular internal audits are crucial to check whether all procedures comply with written protocols and standards. Audits must be done by a trained auditor with no conflict of interest, and findings must lead to documented corrective actions with clear deadlines and responsibilities. Problems become opportunities for improvement. Participating in EQA programs allows labs to compare their performance with others. The most common EQA method is the proficiency testing, but other approaches including rechecking or retesting already tested samples by a reference laboratory or on-site evaluation by an external expert can also be used. Proficiency testing assessments use blind samples and must be treated like real patient samples. Normal testing methods must be followed, and the procedure must involve personnel who routinely perform the testing. EQA is both a quality check and a learning opportunity. Use the EQA results to analyze gaps in the method, reagent, instrument, or human factors and document improvements. International standards like ISO guide the accreditation process. Staff at all levels must understand the requirements and contribute to compliance. It is an accomplishment to be accredited, and it's an achievement to maintain accreditation. The quality managers must convey to all the laboratory staff the importance of compliance with standards, and they will explain the process and organize and prepare the laboratory for assessments. Accreditation is not only about achieving a milestone, it's about maintaining high quality every day. Customer satisfaction is a key indicator of lab performance. Feedback from stakeholders, including health officials, clinicians, and patients, should be collected and used to improve services. Surveys that include feedback, such as compliments, suggestions, and complaints, help guide this improvement. An active quality management system ensures laboratories meet all client requirements. Continuous improvement is central to QMS. We can use indicators such as turnaround times to detect problems. If we identify a gap, we analyze it, apply corrective action, and prevent it from recurring, following the plan, do, check, act, or PDCA cycle. All lab processes should be documented. These include policies, standard operating procedures, manuals, and job aids. Control documents ensure consistency and traceability. Records, on the other hand, are the evidence that procedures were followed and the results are valid. Documents are essential for assuring accuracy and consistency in the laboratory. Achieving robust laboratory data management, whether paper-based or digital, involves a combination of strong policies, smart technology choices, and continuous staff training. Managing data is a core part of lab operations, and the implemented systems must ensure accuracy, security, and confidentiality. Therefore, all information must be accessible for use, yet protected from unauthorized access. Data must be accessible as either hard paper copies or in LIMS to those who need it for timely decision-making, and the system must have indicators to ensure data is correct and delivered promptly. A successful QMS needs clear organization that includes defined roles, a quality manual, leadership support, and a committed staff. A strong organizational structure creates accountability and helps ensure compliance with quality standards. The requirements for successful QMS implementation are management commitment, staff engagement, a clear understanding of the benefits of implementing the system, setting realistic timeframes for implementation, and looking for ways to continually improve the work. In conclusion, quality is not just a technical concept or science, it's a way of thinking, a mindset. By applying the PDCA cycle and investing in quality today, we ensure reliable results, professional recognition, and most importantly, better outcomes for public health. Let's continue working together to strengthen our laboratory systems through quality assurance and continuous improvement. Here are some references used to prepare this presentation. Thank you for your attention.